Hi, I'm Sherry. I'm your medical assistant today. Can you please state your name and date of birth? Yes, Ms. Touche, yes, 7/2/1972. Very good, thank you. And I believe we're giving you a Phenergan injection for the nausea today. Is that correct? All righty, very good. We're going to give this to you in your hip, so I will talk about the location. When we find the location for an IM Z-Track injection, we always want to look at the top crack of the bottom, put a horizontal line, and then we're going to quarter that. So we're going to be in the upper outer quadrant up in this area. We need to be very careful when giving an IM Z-Track or any IM in the hip shot because we need to watch out. Be careful for the sciatic nerve. I just removed the muscle, and this is the sciatic nerve that runs through the hip. Okay. Now I will have you, when I'm ready, I will have you stand with your hands at the edge of the table on the floor. I'll have you stand on the floor with your hands at the edge of the table, and I'll have you prop up your right foot just to help keep you relaxed. Let me get my medicine ready. I did my first check before entering the room. I'm doing my second check now. We've already did the demonstration for drawing from an ampule, so I will not go through the detailed steps this time. I am applying my filtered syringe, filtered needle. I do want to activate my plunger. I want to remove any air bubbles. Okay. Okay, Ms. Touche, I'm going to clean your site, so if I can have you stand and get ready. While that is drying, I will do my third and final check. I do need to switch out my needle. All right. When you do an IM Z-Track injection, you never massage the site. You can apply pressure, but we do not rub because we want the medication to stay deep in the muscle in one location. Okay, I'm going to have you slide down here. I am going to, with my gauze in my hand, I'm going to take my hand in an L shape, and I'm going to pull that muscle to the left. On the count of 3, 1, 2, 3, I'm going to go straight in. I will aspirate, and then I will inject slowly and make sure I count to 10, I can remove and apply pressure. Do not massage. Activate my safety and dispose of my syringe into the sharps. Are you feeling okay? Good. I'm going to let you sit here for a little bit because we gave you the Phenergan for your nausea, and I want to make sure that you don't have any bad reactions to it. And you did state that you had your daughter here to drive you home. We usually do not give Phenergan to a patient that does not have a driver because it can make them very sleepy. Okay. And then I can apply a bandage. When we administer a Z-Track injection, as I demonstrated earlier, we'll have our patient stand and hold the table, lean over, and if you're going to administer to the right hip, you want their right foot propped up. The reason why we do this is two things. One, we want to make sure that they don't tighten their muscle, because a tighter muscle makes it harder for a needle to go in. Two is if that patient, if you hit the sciatic nerve or come close to the sciatic nerve, the foot will jump. Therefore, you know that you're too close to the sciatic nerve and you need to stop the procedure and change the location.